no two people are alike, right? Because we're all individuals. We all have different genetics. We all have different experiences, trauma, and just lifestyle experiences that we've gone through. So how do you define precision psychiatry? That is using biomarkers, other words, labs, including genetic testing, to get to the root cause of the psychiatric problem. So the advantage of precision psychiatry is that I want everybody to know that do we have people have difficulty coming to see a psychiatrist, right? You can tell them, you need to talk to someone, you need to see a psychiatrist. And they're like, oh no, I'm not, crazy, right? They're like, I don't need this. But ever since I started implementing this, I have people who really don't even have a lot of mental health issues, but they come and say, well, I'm curious, like I heard you did this for someone and I want to know like what my labs, what my genetics looks like. And so in a way that takes away the stigma, right? If I can pretty much almost guarantee that I can find a cause for why you feel bad, that it's not just always your fault, like non-compliance or things like that is the reason why you suffer from a mental illness or why you have treatment resistance. Trying to explain to them clinically that, it is a genetic issue, it is a hormonal issue, it is a metabolism or vitamin issue. Trying to address those things kind of removes that stigma and the patients actually get more compliant because you put the power back in them, right? So here, we're not blaming the patient. And with this, we came up with the Brainwell program. I was using it mainly to deal with hormonal imbalance and so forth. But then hormonal imbalance can come from anything, right? Menopause, all kinds of different things, inflammation, as well as head injuries. So I realized no matter what causes a patient to have difficulty getting better, and the main drive of it is inflammation. What we want to do is try to control that inflammation. And how do we do that? It starts with getting the brain healthy through the Brainwell program. Because some people say, I never had a head injury. And you're right, you probably didn't. But why are you having difficulties balancing your hormones? Why are you feeling bad? Why are these things happening? So the purpose of it, yes, we need to heal the brain. And how do we do this? A comprehensive workup, which we're going to get to, and come up with a complete treatment plan that is unique to the individual. Because I don't believe in, I would say, protocol medicine in a sense that everybody gets the same treatment, because what will be helpful to one may not be helpful to the other, may make them worse. So I always tell my patients who are part of this program, don't tell people what you're taking, because what would be good for you would not be good for them. And vice versa, because this is basically a culmination of like all my experience with just general psychiatry, as well as learning and asking questions and so forth, and then starting to see a connection between all those components that I discussed earlier. And no two people are alike, always, okay? And so I think that's also the missing thing, that when it comes to treating patients, we have to treat them as unique, as individuals, and go through the background of what they've been through, as well as family history and so forth. What is the goal out of everything that we do here? When we find the actual cause of why people feel bad, we give them the plan, and they'll get the long-lasting results that they've been looking for.